Okay, sorry. All right, so now it's recording. Can you guys see the screen?
Yes, thank you.
Sorry. Okay. Um, okay, so for the agenda, so I'm gonna quickly go over the purpose of this webinar. I'm gonna do an overview of the latest COVID-19 news, and then I'm gonna do the updated mask and vaccination guidelines, testing sites, vaccination verification, and how to prevent spreading COVID-19. And then the Q&A at the end. Okay, so the purpose. What is the purpose of this webinar? So the purpose is just to keep everyone updated and simplify the latest COVID-19 news and guidelines. I know there's a lot of news out there. There's a lot of new rules, right? So hopefully this webinar will just like simplify things and keep everybody on the same page. And also, I'm here to help answer your questions or whatever concerns you might have. I will try to help you. And just keep in mind, I'm not a doctor. I'm not a nurse, but just so any clinical questions that you might have, just write it down, and then we'll try to like figure it out at the end. And if I can't answer your questions now, I will definitely email you um, uh, with whatever answers that I might have. So yeah, so here's a quick daily update. So here on the left, oh sorry, someone's entering right now. I don't know the person. Sorry about that. Maria, hello. Hi Maria, can you hear me? Okay, so I think she can hear me, but I'm just gonna go on. So this is a quick daily update that we have. So as you can see here on the left, this is from March 19th. So about 2 days ago. This is from the California Public Health, Department of Public Health. So as you can see here, we have 727 new cases, 25 new deaths, 432 current hospitalizations. And over here on the right, you can see there have been over 7.2 million residents have been fully vaccinated in the LA County. It's actually one of the highest vaccinated rated counties in California. Yeah, so all these numbers are good, especially on the left, and I'm gonna go more over these numbers on the next slides. And here, so according to the CDC's new community level framework, the COVID-19 community level is low in LA County. So what does that mean? So if you would take like 100,000 residents anywhere from the LA County, it's saying that fewer than 200 of those 100,000 will have COVID. And then out of those 200 that are getting positive for COVID, less than 10 are being hospitalized. So that's really good. So not only we are getting fewer positive cases, we're also like, and if they do get COVID, it's not as severe. They don't need to go to the hospital. So they're not taking them the beds also. So less than 10% of inpatient beds are being occupied by COVID patients. Yeah, so it's really good numbers. That's why there's new guidelines, because we're in this low community level. However, it is a pandemic. It is very contagious, and we're still in the pandemic. COVID hasn't gone away, so we could easily go back up to the medium if we don't follow the guidelines, right? If we don't keep doing what we were doing before to keep us low. If we were to just all of a sudden stop following the rules, we can go back to the medium, or maybe even high. So it is important to still keep following guidelines. And yeah. Okay, so here are the new guidelines. So effective March 4th, indoor masking at most public settings will be strongly recommended, but not required for vaccinated and unvaccinated individuals. I'm sure some of you guys have noticed this already. It is up to the business, or wherever you're going, it's up to them now to require the mask. It's not mandatory anymore. So it's up to them, and it is up to you whether you feel comfortable, or it's up to you whether you want to wear the mask or not. But some will require it. For example, like public transportations, they are still required. You still need to wear them. Emergency and homeless shelters, that's still needed. Healthcare settings like hospitals, correctional and detention facilities, you still need them. Schools, K to 12, until March 12th. I know there's some schools that are still, requiring their students to wear them, and some aren't. Personally, I haven't heard of any schools that are not requiring the masks, but yeah, but according to the rule, it is up to the school and long-term care facilities. And here, employers will be required to offer medical grade masks and respirators. So if you need masks, you can always ask your employers, and they should provide it for you. Yeah, and here, like I said, masks are still required, are required at schools and childcare facilities until March 12th. And then after that, it'll be strongly recommended. It is still strongly recommended for everyone indoors, regardless of vaccination status. It is still required for those who exit isolation or quarantine early through a 10-day isolation or quarantine period. And as a reminder, people can wear a mask indoor or outdoor settings if they choose to. So again, it is up to you. Depending on your comfort level, it is still up to you if you want to wear the masks. And here are just some different masks that are available out there. I'm sure most of us are familiar with these already. So we have the cloth mask right here on the bottom. This is considered a fair mask. But this is still better than not wearing a mask. We have the surgical mask, which is considered good. This is, most people wear this one. We have the KN95. This is a more, I'm seeing more and more of this now. I think the city was giving these away, a lot of these. And yeah, this is better than a surgical mask. It filters more of the, things that are coming in and coming out. So it is considered better than a surgical mask. And then the N95, this one is usually used for hospitals. You have to get fitted for this, professionally fitted. And you do, like in the hospitals, if you work in the hospital, you get this card and it'll say your size for this kind of mask. But yeah, this is more if you're like in the hospital around other COVID patients, or if you're around someone that has COVID for sure, you want to wear this one. And this one, because this one filters the air not only in, but it also filters the air coming out. So yeah. So here for COVID testing, you should still get a COVID test if you were exposed to COVID-19 or if you have symptoms. So if you want to find a free site near you, you can visit this website. And if you need this, I can provide this for you. I will have this on the email after the webinar. So what you do here is you click on this link, and then here you just put your zip code or your address, and it'll show a map of all the testing around you. And you could put in even like how many miles you wanted, within 10 miles, within 5 miles, stuff like that. And then the next one is you can also use the LA County Pickup Testing Kit program. So here you go to this website, and you will see all the locations where you could pick up a test. What you do, it is a PCR test, so it'll take between 3 to 5 days. It is not a rapid. What you do is you go to this website. You do need a smartphone, and you do need to download an app, and that's how you'll find out your results. So you go to this site, you pick a site, you go there, you pick up the test, and then you could either take the test back home, but you do need to return it to the site. So you go home, test, and then go back to the site, or you could just stay in the parking lot, take the test, and then return it to the site. But you do have to return it. And like I said, you do need a smartphone and an app for that. They have all the instructions online. And again, I will provide this link. And then the second one here, LA County Home Test Collection Program. This one is for people that are unable to leave their homes. So if you're a senior citizen, this is for people who are 65 and over, and also for disabled people. So how this works is that FedEx will ship you the test. It should arrive within 2 days after requesting it. It'll arrive to your home. You take the test, and then you go to the FedEx website. You schedule a pickup. You have to schedule a pickup, and they'll pick it up for you. And you should get your, and this is also PCR, and you should get your results within 3 to 5 days. But you don't have to leave your house. So that's how that one works. And again, this link will be provided. Testing is still required to exit isolation or quarantine. Isolation and quarantine help keep people who are sick or exposed away from others. And here, this is just a little slide that I put in because I just want people to be aware of like fake COVID sites, and yeah, because especially beginning of the year, there were more of these. There were just like little pop-up tents that would pop up, in front of like random parking lots or, like stuff like that. So anytime they ask for your bank information or social security number, that's automatically a red flag, right? You never give that information. They should just be asking you things like, what's your gender, what's your address, phone number, maybe, if you're, and your email. But yeah, that's all the information that you should be giving, right? You never give out your bank information. And if you feel like you've been if you've gone to a fake pop-up site before and you gave them information, you can call this number and they can try to help you. And they've actually also they've done they speak Spanish also. I'm sorry, they speak Spanish. Sorry, there's another person trying to get in. That person's in. Okay. Okay. Yeah, so just be aware of that. And then next slide. Vaccination. So vaccines and boosters are still the best way to protect yourself and your family. Unvaccinated people are at a much higher risk of going to the hospital or dying from COVID-19. And here's just a little slide. This for the Tagalog speakers out there. Palakasin ang immunity para sa mga 12 hanggang 17 na taong gulang. This is basically saying, anyone from 12 to 17 can also get the booster. And the website's down here below, myturn.california.gov. And of course, this is not just for 12 to 17, right? This is for everybody over 17. For adults, if you haven't gotten your booster or if you're not vaccinated, just go to this website or call this number to schedule your appointment and for your vaccine, and it's all free. And this slide is just saying who's eligible to get the who qualifies for the boosters. So as you can see here, for the Pfizer, anyone over 12 can get the booster. And it's so if you got your primary vaccine 5 months ago, you can get the booster now. And if you're over 12 and above, you can get the booster. However, for Moderna, it's only for 18 plus that you can get the booster. You have to be 18 and above. And so it's for Johnson & Johnson. And for this, if you got the primary vaccine as Pfizer, you can mix and match. So for the booster, you can get a Moderna, or Johnson & Johnson. So you can mix and match. If you got Moderna before, you can get Johnson & Johnson and Pfizer. But just to let you guys know that CDC are recommending only Pfizer, Moderna right now. They're not really recommending Johnson & Johnson, but it is still available. Vaccine verification. So you still need to show proof of full vaccination to attend indoor mega events. So indoor mega events, I think is considered as like concerts or like, sports, like basketball games, and like NBA games and stuff like that at Staples Center. So I think those will be considered indoor mega events. If you are unvaccinated, you need to provide a negative COVID-19 test results. However, vaccine verification is no longer required at outdoor mega events or indoor portions of bars, nightclubs, and lounges. However, it is strongly recommended. So what to do if you have COVID-19? So I'm sure everyone's already familiar with this, but it is important to go over and to just remember you still need to do these things. So if you have COVID, you have to determine isolation and period away from others. You have to notify all your friends and close contacts, right, or your family, so they don't get close to you. You have to medicate and rest. Drink plenty of fluids, and you can take over-the-counter medicine such as Tylenol if you have like really bad fever or a bad pain. However, if you have some type of if you are immune compromised, so if you have a different sickness, you might want to talk to your doctor before you take Tylenol, just to make sure. Mask up. Yeah, just keep wearing your mask whether you're indoors or outdoors. If you have COVID, make sure you always wear your mask and only go out when it's absolutely necessary. Just stay inside. Social distancing. Like, yeah, right now, obviously things are like lifting up. Things are starting to go back to normal. So this is being ignored now, but it's still important to remember. Like, so if you're gonna have any activities, with your friends or family, any gatherings, try to choose outdoors. Try to go to the park, and if you have a backyard, try to do it in the backyard. And if you must be indoors, just try to avoid super crowded places, and if you're going to invite friends, instead of inviting, 20 people, maybe just keep it to 10 people, and then, invite 10 this week, invite 10 next week. Just try not to be like, too crowded. And if you are inside, keep your doors open, make sure you have good ventilation, you have your windows open. And then when you're indoors, try to stay at least 6 feet away from others and wear a mask. Over the age of 2, you have to wear a mask. Use drive-through or curbside pickup when possible for food orders and shopping. So when right, especially right now, there's a lot of curbside stuff, right? You could go to the mall. You don't even have to get out of your car, and you could be like shopping from the parking lot. So yeah, just try to use that as much as possible. Try to take advantage of that. Even food, like just try to do curbside, and also try to use online. When you can, just try to shop from home instead of going to the store, and that's just another way of like avoiding contact. Hand washing. This is still very important. Like I said, right now the community level is low. However, it can go back up if we're not too careful. So hand washing is still very important. I know it's like you know everyone's thinking now it's like it's normal, but this is still very important, right? So just a quick step on how to wash your hands. Make sure you're using, you could use either warm or clean water, but make sure you apply soap, apply it deliberately, right? Rub your hands together. Do this for at least 20 seconds, get between the nails, under your nails, between your fingers. Make sure you go up to your wrist, right? You can hum the happy birthday if you don't like counting, and make sure you're drying also on your rinsing wall afterwards. And if there's no, I know sometimes you can't be washing your hands, right? There's no sink or there's no water or soap available. You can sanitizer will be fine. Again, this is yeah. But when you're choosing a hand sanitizer, make sure it has at least 60% of alcohol. Um, that's one of the recommendations. Hand sanitizer should be stored out of reach and out of sight of children. It should not be stored above 105 degrees. Don't store it in your car, especially during the summer. It is flammable. So when you're using it, avoid activities that might involve heat, sparks, or electricity, or open flames. So the next couple of slides, there's just some recommendations for you to apply in your daily life to fight off not only COVID, but any type of disease out there. Right now it's flu season, right? So this is just some suggestions that you can do to boost your immune system. So you're less likely to get sick. So the first one is diet. We all know how important diet is, right? So right here, this picture on the left, this is from My Plate. You can go to their website, and this is basically what your plate should look like. You should have a little bit of fruit, vegetable, grains, protein, a little bit of dairy. So every meal should look like this, right? It should be balanced. Um, Make sure you're getting your proteins, vegetables, very important. And yeah, and make sure you just mix and matching throughout the day, and just try to keep. I know like some of us like we like the fried foods and stuff like that, right? But just try to keep those at a limit and make sure, yeah, make sure your diet looks like this. Physical activity, another great way to like boost your immune system is just being active, right? You could do this by just going outside for a walk, go to the park. You could take your dog for a 30-minute, 45-minute walk. You could go hiking. LA is known for a lot of great hiking places. You could do a beach hike. You could do whatever you want. You could even email me and I could suggest some hiking spots for you if you want. Yoga, yeah, you could do yoga. If you're at home, you have some space or you can't leave the house. You could do yoga. There's a lot of videos online. It's good, and it's not only good for your body, it's also good for your mind, right? And then you could also do like 30 minutes of family activity. You could play catch, hide and seek if you have kids, stuff like that. If that dancing, if that's your thing, you could do that. Sing karaoke, take the stairs. If you live like in an apartment, you could take the stairs to the first floor or whatever it may be. But obviously, don't hurt yourself. You could do these things. Don't overexert yourself, right? Do this carefully. If you have trouble walking, of course, don't take the stairs, right? I'm not saying like, yeah, just make sure you know your own limits before you do these things too, right? So yeah, for sleep, um, you know, obviously sleep is very important. This is another great way to boost your immune system. For adults, everyone should be getting 7 or more hours, right? For kids, even more. Um, so I know some of us have trouble sleeping, so these are just some suggestions to improve your sleep. Be consistent. Try to sleep at the same time each night. Make sure your bedroom is quiet, dark, relaxing, and the temperature. You have a good temperature, whatever is comfortable for you. Don't use tobacco, don't drink coffee or drink alcohol before bed or any time at all. Try to like limit those things. Remove electronic devices such as TVs, computers, and phones. Just remove the distractions, and make sure you're getting some exercise. Like I said before, um, and this will just help you sleep. And here are just some couple of facts and myths that I'm gonna quickly go over. These are like common myths that everyone have. And this is from the CDC. Are COVID-19 vaccines safe, even though the vaccines were developed rapidly? Um, that's the myth. And the fact is, while COVID-19 vaccines were developed rapidly, all steps were taken to make sure they are safe and effective. Pregnant, if you are pregnant or planning to become pregnant, can I still get the vaccine? Yes. Vaccination is recommended for people who are pregnant, breastfeeding, trying to get pregnant, or who might become pregnant. And of course, if you are pregnant though, like you do still want to talk to your doctor. That's very important. If you have any concerns, questions, yeah, definitely talk to your doctor. Another one, are the ingredients in COVID-19 vaccines dangerous? Nope, that's a myth. What's the fact? Nearly all the ingredients in COVID-19 vaccines are ingredients in many foods, um, such as fat, sugars, and salt. So yeah, the actual vaccine doesn't have any virus in it. It's just fat, sugars, and salts. It just like what the vaccine does is not injecting you with the virus, right? It's just making your body react as if that was the virus. So next time, so hopefully you don't get it, but next time you do, if you do get COVID, your body was already exposed to, the COVID, so it'll know how to react to it and act faster. So here's another myth: the natural immunity I get from being sick with COVID is better than the immunity I get from COVID vaccination. No, that's a myth. So what's the fact? Getting a COVID vaccination is safer and it's more dependable way to build immunity to COVID than actually getting sick with COVID, right? With if you get the actual COVID, you never know what can happen, right? We've heard stories before of like healthy people, young people, having to go to the ICU, right? And even like unfortunately, even passing away. So it's safer to get the vaccine than if you have that mindset of, oh, I'd rather just get sick because it's the same thing. No, it's not the same. Myth: COVID vaccine cause variants. Yep, that's a myth. What's the fact? COVID vaccines do not create or cause variants of the virus that causes COVID. Instead, COVID vaccines can help prevent new variants from emerging. Okay, sorry, just gonna quickly go over this because we're running out of time. Myth: COVID vaccines contain microchips. Nope, that's a fact. COVID vaccines do not contain microchips. Our COVID vaccine can make me sick with COVID-19. Nope, that's a myth. What's the fact? Because I already mentioned this earlier, because none of the authorized COVID vaccines in the US contain the live virus, you cannot get sick with COVID-19. You might experience some symptoms, but not like get fully sick, right? Myth: COVID-19 vaccines will affect my fertility, like, with pregnancy and stuff. Nope, that's a fact. That's a myth. What's the fact? Currently, no evidence shows that any vaccines, including COVID, can cause fertility problems in women or men. And yeah, so these are just the resources and some of the links that can provide for you. And yeah, that's all. Does anyone have any questions? Okay, if there's no questions,
Thank you.
you're welcome. Um,
Thank you so much, Mark.
you're welcome. So yeah, I'm gonna email you guys all the resources, everything that I've talked about here. Um, yeah, thanks for coming. Hope you guys have a good day. And again, if you have any questions pop up, just email me or call me. Thank you.